and we'll discuss some of cases. And I had one case on the WhatsApp, so we'll discuss that if everybody is online. So there was a skin disease where somebody had mentioned about that the patient has already been given arsenic, and there's a lot of itching after vaccination, and the patient is very frantic and itching too much, does not stay well. Lot of symptoms of skin itching, especially after vaccination, was there. So I'll discuss that when we come online. Now, let us have some of the few cases which I have seen last week and have got good results. Of course, those are basically learning cases because sometimes, last time I told you something about delusion, and I hope everybody could understand and relate their cases to delusion, as it sometimes become difficult, to understand those. So, welcome, Dr. Santosh. Hi, Santosh. Hi, Venkat, Meera, Isha, Sumita, Nigam, Rahul Chaudhary. Sometimes it becomes very difficult to understand and appreciate the delusion present in the patient's whole case. Normally, what I have seen in my practice, that when we take a whole case and you're prescribing on those one symptom, where you take the bird's eye view of the case, you have to be very sure and you have to be very specific in what are you taking for interpretation. That is very important. Good afternoon, Dr. Nigam. This is important because when you take a rubric, for example, there's a rubric called delusion. The patient feels that is always alone, or the patient feels delusion that he is always alone in the whole world. If you see these rubrics, delusion always alone, you have a remedy called pulsatile and stramonium, and the whole other mathematica of our homeopathy just goes because this rubric has two medicines. So when you are very sure, then when you take the rubric for prescription, there were a lot of questions, were there after the last YouTube and Instagram. I just want to clarify that whenever you are taking a bird's eye view, very, very important to understand. You understand the case as a whole. That is very important. Welcome, Dr. Uppan. Now, there was a very interesting case. Of course, all cases are interesting. Related to that, I had a very interesting case that patient used to feel that he describes that everything is there in the brain, but I cannot think. I have to just move my head, and I feel everything just scatters off, and then I can start thinking. This was the case, and there was a it was a case of dysmenorrhea, and the lady had this type of symptom. Of course, we never took that for prescription, but once, twice, thrice, every repeating after 15 days, the patient got relief. And this sentence the patient kept on repeating, and then after adding this symptom with other symptom, we prescribed the patient one dose of Laccan, and the whole menstrual problem was set normal. Laccan 1 m. So how do you relate, or how do you understand the mechanism of this symptom, and how the symptom we repertorized, and how did the Laccan come into prescription? Can anybody give the answer? Try to, because this is something very new which I have started telling in offline webinars or online, both webinars, and it is becomes very interesting, and Laccan. You never think of Laccan. The patient had telling me this symptom. Anybody? Dr. Komal, welcome. Anybody? Can you tell me what symptom we took for prescription? Good afternoon, Sunita. Now see, I'll just again read the question. Yeah, Dr. Meera, thank you so much. And as the days are going by, a lot of celebrity related to all fields are coming, and it feels very nice, that we could help those personality, and homeopathy has been taken by those. Thank you so much. Yeah, Dr. Vinaya. So I'll again tell you the symptom. There was a lady suffered from menstrual irregularities. One symptom which was very common, the lady said that whenever I start thinking, I cannot think. I just shake my head, everything gets scattered, and then I start thinking. And this was basically the symptom we took for prescription. Anybody can tell me what symptom it? Of course, I gave some medicine not related to this symptom, but it did not work. And after 3 weeks, again the patient came, and there was no change after changing medicine twice. Then I gave the patient one dose of Laccan, and the patient was cured. So can anyone think? Can anyone think what remedy? First of all, what interpretation I did of that symptom, and then I'll tell the remedy Laccan was given. Dr. Ashish Sharma, welcome. Dr. Vinay, Dr. Disha, Dr. Sachdeva. Shifting side. Remember the wordings of the patient. She says, I move the head like this, everything disperses, then I can think clearly. Such a very, first of all, I never agreed. I thought maybe a patient maybe must be stressed out, or the patient was not happy with the condition and she was maybe angry. That's why she was doing like that. But I never took for prescription. But because the remedy did not work, then I started to think how and why the patient is telling you this symptom. As I told you in the last YouTube and Instagram live, these are cases which basically teach us. Otherwise, we have some common remedies and then that gives us good results, but not cures sometimes. Yeah, Dr. Yugita, welcome. Good afternoon. So, can anybody think something more? What I thought, apart from what doctor has said, shifting sides. It is very difficult to understand, very difficult to understand why this happens. But it did happen. Anybody? I hope you can hear me properly and see me properly, okay? Good afternoon. Yeah, so we are still in that question. Yeah, Sumita, 12 others joined. Yeah. So, Dr. Babel, Dr. Vishaka, you know what question what case I was telling you, and I hope you understand that. So, just tell me what I thought of. I'll again repeat once. The patient came and said that I have to just move the head like shake the head like this. Everything gets scattered in the mind, and I can see clearly, and then I can decide what to do and what not to do. We prescribed the patient 1 dose of Leccan 1M for menstrual irregularities, and the patient was cured. Any other symptom, any other interpretation you get in the mind that we are able to prescribe Leccan, and why did I prescribe Leccan? Anybody? Yes, anybody? Purva has a view request. I cannot view because otherwise something else goes wrong in the Instagram. So I just took the prescription, delusion, as if enveloped by a cloud. So when she moves it, the cloud gets scattered, and then she feels better, and they can starts thinking. And then the remedy Laccan was prescribed, and the patient was cured of his menstrual irregularities. I hope you understood that symptom, how to unveil the symptom. Sometimes it appears very stupid. Dr. Madan would have. Sometimes it appears very stupid that the why the patient is behaving in such a way. But that's how you have to basically prescribe. I hope you understood how did I interpret that symptom and why did I give Leccan. Anybody? Everybody? Yes? No? So that I can go further, okay, and get you some deep aspects of homeopathy prescription where interpretation is a very important symptom. Anybody? Did you understand that symptom? For example, well, I had a very interesting case of simple lot of tachycardia. The patient had lot of tachycardia, lot of tachycardia, and because of that tachycardia, the patient, Dr. Deshand, lot of tachycardia, and tachycardia, and the patient suffered from one symptom. He used to do like this. Every time during case taking, he was doing like this only, like this, like this, like this, like this. In the whole case taking, he was doing like this. So now, how do you interpret this symptom? Anybody? I'll tell you the remedy, but see the interpretation. Sometimes interpretation becomes very important. Yeah, explain. See, if there is a cloud is totally air. So when the patient moves the head, he feels that the cloud has been scattered, and then she can think very clearly. But after some time, it is back to square one. In that case, there is a delusion that the cloud has enveloped over her. So the remedies are Laccan and Semicifuga, two marking remedies. Adding two symptoms of Laccan, we prescribed the patient Laccan for menstrual irregularities, and the patient was cured. Next case, there was a case of tachycardia, and the patient in the whole case taking was doing like this. Just हम बोलते हैं झटक रहा है कोई चीज. So what interpretation comes to your mind? Anybody? How do you interpret this type of symptom? Anybody? Clearing cobwebs, very nice. That's a very, very interesting symptom, and that was a very, very interesting interpretations also. So sometimes if you take that symptom for consideration, a simple remedy I prescribed to the patient was Sumbul. Sumbul. If you go to a Mater Medica, only one remedy is not only cobweb on the face, but different parts of the body, and the remedy was Sumbul. So this is how you have to start. No, this is was very much rightly said, clearing cobwebs, or you can say cobweb movings in different parts. The remedy was Sumbul. You can think about fastidiousness, you can think about formication, you can think about that. But what I prescribed was Sumbul, by taking this symptom, that cobwebs moving on different over different parts of the body. These are the symptoms of patient innate character. The inner core symptom is this. That's why if you are able to interpret symptoms in homeopathy, automatically everything will fall into place. Sometimes it becomes difficult, but as you grow in your practice, I'm very sure that you'll be able to understand and interpret this symptom very precisely. So I've discussed two rubrics, and how you interpret these symptoms. If you have any questions, you can start asking questions. Otherwise, I keep on asking and the half an hour is over. Okay. And I hope you remember the other symptoms also, where I last YouTube and Instagram live, where I prescribed some different remedies and interpretation was different. Okay. So that's why I'm just taking you to the another level, where you have to start thinking, how does this symptom have come in your Mater Medica in the proving, and how we can relate this in the symptoms case, in the symptoms of the patient's case. That is very important. Okay. So, sir, tinnitus can be cured. See what happens if you ask a homeopath like me. Uh, in 25 years of practice, I have seen, I have cured lots of cases where I never thought I'll be able to cure cases. Advanced brain tumors, advanced psoriasis, cancers, renal failures, coronary artery blocks, and so on and so forth. So I'm always positive, and I feel everything is curable, provided your remedy has to be absolutely right. So it is definitely curable. And tinnitus is basically, if you go to the whatever cases I have cured of tinnitus, basically the patient is fed up by hearing a lot of advices, just explaining, people just telling him to do this, do this, do this. He's so much exhausted and so much frustrated, and then tinnitus starts. If somebody is not talking, also he feels the talk. That is because of the ennui and the boredom and the anger he has of that person, because everybody is trying to show him something, and that's how tinnitus starts. So if you have a patient, and if this is the history, you must take this into your consideration. I am caffeine who has joined. So cobwebs are confused thoughts. Okay, you can always relate that to basically what you call in psychological practice, and you can always have different interpretation. I am telling you at verbatim what I felt, and I prescribe the remedies. Okay, and because when you cannot arrive to a firm decision, there are other ways also to understand why you cannot arrive to a firm decision. You have to say, in Sora, is the patient always indecisive? Is the patient having a loss of confidence in Sora? And that's why, if that is the case, then automatically everything will change your prescription. I was just telling you the interpretation, what you can see and understand in the case. Okay. Patient has OCD, and he always has to shoot by fingers whatever and whoever is in front of him. Only then he can do task. No, you see what happens in OCD. There are some there are some motions. There are something in the patient where he keeps on doing continuously. So if you take this for prescription, you will not be able to cure that case, because that's a normal symptom of OCD, obsessive compulsive neurosis, obsessive compulsive disorder. Remember, it does not come out of the blue. Watch in Sora. Watch in Sora, which he had, but now in psychosis and syphilis, it is out of control. For example, I always give the example, if the patient is fastidious, the fastidious increases too much, and it becomes so fastidious, it goes out of control, and that's why the patient lands up in OCD. In OCD, whatever cases I have cured, make sure that you have a psoric history very properly, because only that would give rise to OCD. It will never come out of the blue, child child 4 years, HB 8.5 at constant fever, emaciated, facial expressions weak, very slow in nature. Ferrum for 6x was given little better, hemoglobin 8.5. See, if you just want to increase the hemoglobin, there is a latest remedy which has come in our homeopathy market. It is prepared from hemoglobin only. So it is written there that it increases the hypoxia, and you can try that medicine hemoglobin 6x power. I have never used ferrum to increase the hemoglobin, because I always feel when hemoglobin is low, that means the erythropoietin, which is there from the bone marrow coming, is not coming properly. That means it's a gross constitutional state which has to be treated. So in this case, it is very important to understand. You have to prescribe through case taking, and then only you'll be able to understand. There are some remedies which I have learned and have seen in my practice which people use. First is of course ferrum, second is hemoglobin, third is lecithin, fourth is ginkgo biloba, and so on and so forth. These are the remedies. Sometimes some patients use alpha alpha also in expotency or mother potency, and that also give good results because the patient is anemic. But if your patient is suffering from recurrent fever, just ask the history, because recurrent fever without any cause, I have seen carcinogen works wonderfully. So ask the history and the psoric history, or the mother and the father's history, and then carcinogen should work very well. Welcome, Dr. Mishra, Dr. Tanmay, Dr. Purva, Disha. Pain in, good afternoon, Dr. Amit. Pain in left heel and with severe tendency, pain, pressure. I don't know. Now, patient feels the pain does not go. Her whole routine goes for a toss. Doesn't like disturbance in routine. See, I have this is basically calcaneum spora plantar fasciitis. I have seen in many cases. In many cases, I have not got, if I have the case taking was good of my assistant not taking the case properly. 3-4 remedies, Dr. Disha, will work wonders. It has to work. First is Ruta graveolens, second is Ledum pal, third is Rustox, fourth is Guaiacum, and fifth is Erenia diadana. I think I have told this in lot my Instagram live and YouTube live. These are the 5 remedies. If you have LM potency given in repetition, it will definitely work. It will definitely work. Sir, black spots on hands and thighs, no other complaints. What can we think? See, remember one thing, Dr. Tanmay. Nothing will come without a cause in the human body. Unless the body allows, nothing will come. But if you just feel that there are, black spot, there's always a physiology inside. There's always a mind inside which is working. Sorry. So if you just want to see that the discoloration blackish, there are 3-4 remedies that you should think about. First is Arnica montana, second is Merxol, third is Cuprum metallicum, fourth is sickle core. So let us continue. So something wrong went on the YouTube, so we lost connections. Roughness of cheeks and nose. See, caffeine. I am caffeine. Whenever the patient suffers from roughness, roughness means dryness. Most of the times I have seen it is because of dryness of emotions. Probe that. But just you want to know the remedies, you can think about natrum sulf, you can think about X-ray, you can think about sulfur, you can think about bryonia, you can think about those remedies which will work very nice. But it is because of dryness of emotions. Dr. Fatima, uh, patient has become hysterical after breakup. I happened 4 years ago. Natramo did not help. Which See, when the patient becomes out of control, now whenever we have disappointed love and the patient goes out of control, two things are very very important. Either the patient feels that how could a girl or how could a boy tell me no, his ego is hurt. Maybe because of the ego there is a problem. In most of the cases I have seen that the ego is the problem, so you have to curtail the ego. Natramur, in most of the cases I have found, it does not work. So first find out what has happened. Either it was love that has taken a problem, or it's the ego. Most of lot of times I have seen acid phos, lycopodium, stephysagria works very well in these cases in hypotency. How to tackle dyslipidemia, which does not respond to cosmetic. Everything improved, including blood sugar, but lipid levels are not ready to come down. Welcome, Dr. Navjot. I've already told you once in my practice, in my YouTube and Instagram live, that see, I have seen lot of cases of YouTube and lot of cases in my practice where I have seen that everything, the blood accumulates lot of impurities, calcium debris, because there is mental accumulation, the patient suffers from silent grief, everything is accumulated, and the sorry, there was a problem in the Instagram. So there's a lot of accumulation of thought process and accumulation of dirt, accumulation of thoughts which you cannot get out of the system, and that's why the cholesterol occurs or CAD occurs. So in these cases I have found very good results in cases where this is thing, and grief silent is the rubric which I have taken for prescription, which gives me good results. Okay. Sir, for hirsutism, when what can give to reduce is, it is curable, Dr. Tanmay, and I have seen that hirsutism basically is a syndrome, PCOD syndrome. That's a hormonal imbalance, and whenever there's a hormonal imbalance, most of the times I have seen case taking would increase the case. I'll just discuss a case. I had a case of hirsutism where the patient did not get the menses properly. She had a PCOS syndrome, and after taking the case, I also prescribed some medicine. It did not work. I found in my second and third visit, the patient was basically talking. He had a voice like a boy, talking like a boy, walking like a boy, like a male, dressing like a male. So I found that the testosterone was high in those cases. I prescribed the patient, the lady, the girl, testosterone 1 m single dose. In a course of 4 months, PCOS was cured, the menses was cured, and the hirsutism was also cured. So this is how you have to tackle the cases. Welcome, Dr. Palak. Uh, how to tackle dyslipidemia? I have done that. Patient has hysterical breakout. We'll do that. I hope you understood, Dr. Tanmay. It's a very interesting case because it becomes a very much big trauma. And what does the patient do? The skin specialist tell the patient that you do laser 5-6 times, automatically hair will stop coming. But if do lot of suppression, whatever there is in the skin, it goes inside, and then it can have some other problems also. So explain the patient, and these are the cases I have seen. Sometimes patient takes lot of pills not to get the menses or to delay the menses. In those cases, testosterone, progesterone, estrogen will play a very important role as a constitutional medicine also, and as an intercurrent remedy also. So make sure that you have these remedies and you study a little bit of Mater Medica, so it helps you in your practice, Dr. Tanmay. Female is hemoglobin 6. No, hemoglobin 6 says I have the literature. I have not prescribed the medicines. Female 45, pain neck extending to arm, pain from hip towards leg, hair falling, motion may help, cheerful in nature. You can think of some remedies like belladonna. You can think of remedies like carcinogen. You can think of remedies like lycopodium, phytolica. These are the remedies which would help in your case, Dr. Madan. 20 as male having burning under arm without itching, with perspiration, aggravation, traveling, emulsion, cold bathing, eliminates from using trimmer or hair removal. Burning in the palm is a basically local symptom. You can use a rubric where there is written that burning local area, congestion in the local area, and there are lots of remedies. Do think of that rubric, and then you can prescribe by adding to one or two symptom, and you get the remedy. Local symptom. There is a rubric, congestion in local parts. Dr. Vibha, welcome. So can you some questions have scrolled up. Yeah, you can ask the question. Hemoglobin 6 I have not used, so I cannot tell you that. Sir, mom is fine, now facing hypoglycemia phase, units are reduced, Dr. Saab to recheck her creatine level. Very nice. Sir, mom is now facing hypoglycemia. It is not the creatine level, our medicine is working, Dr. Navjot, so automatically she'll be off allopathy medicines or insulin, whatever she's taking. She is on the way to recovery. She will definitely improve. It may be because sometimes when the creatine goes up, the sugar goes down. But in your case, I'm very sure the creatine is normal. The medicine is working. That's why the sugar is going down. So don't worry about that. You can check and revert back to me. Okay, fine. Remedies for upcoming change of weather. Yeah, this you must tell me. We have done so much in these type of remedies. Where change of season will basically give you a lot of symptoms and all. So anybody could start somewhere and will basically have lots of remedies. Change. Does knowing miasm help in prescription, or I can just stick to striking? No, miasm is very important. If the disease is syphilitic, it is very important to take a syphilitic symptom. Miasms are very important. Sir, share Matermedica if hypozinum. Yes, we'll discuss that change of weather. That's important. So we have from Dr. Venkat Dalkamara. Any other remedy you basically have when there is change of weather? Anything about that? Anybody? Change of weather. We have discussed. Most of you know that. Change of weather remedy first is Dalkamara. Very nice. Anything else? Natrum sulf. Very good. Rust tox. Very good. Any more remedies? Okay, so you can keep writing. I'll just finish off Dr. Yasin's question on hypozinum. Now, I'll be just discussing hypozynium, which I have used in my practice. Yeah, natrum sulf rust tox is there, tuberculum mux all, yes. So let me just tell you what I have seen in hypozynium. Okay, I don't know what is written in the Mater Medica, but whatever I have got result, I'll just discuss. In hypozynium, remember, the breathing is very noisy. There's excessive secretion and bronchitis in aged. I had cases where ammonium carbide failed, and in that case, hypozynium worked beautifully. Because there is bronchitis in aged, but there's a lot of suffocation from excessive secretion. And that's why hypozynium is used for snoring also. Snoring also, because this is the complaint. It is a very important remedy where all the glands of the face are swollen, they are painful, and it becomes abscess. I had cases where I had prescribed Hiparsulf, I prescribed Cilicia, Myristica, did not work. But when I was reading hypozynium, it came to my notice, and hypozynium cured the case. This was the second case. Third case which I have seen in my hypozynium is in coryza, the nostril is red and swollen. Very, very important symptom of hypozynium. The nostrils is red and swollen, and the discharges are acrid, corroding, and offensive. So these are the symptoms which I have used in hypozynium. Of course, direct prescription I never used for before years, because I used to use the acute remedies. But now I know hypozynium, that's I prescribe in this type of symptom. This is the only knowledge I have of hypozynium, whatever I have seen in my practice. Okay. SMS 4822 join. So I hope you understood something about hypozynium, Dr. Yasin. And change of weather, we have prescribed, you have given a lot of good remedies. Dalkamara is there, natrum sulf is there, rust tox is there, tuberculum mux sol. Yes, everybody is right. And so I'm very happy that at least some remedies you are answering. So I also sometimes get to learn. It's not always that mathematics is easy. It is basically keep learning, keep reading mathematics, and you'll be surprised. Sometimes your interpretation is sometimes out of the world, and the remedy also comes. Sometimes your understanding of the remedy is something different. Is keep on reading, your understanding of the remedy will keep changing, and read the basic books. Okay. So I think that's all. It's already 3:30. If we have few questions, Dr. Madan, I hope you understood, and you'll prescribe the remedies, and we'll basically have some good results. Yeah, Brian tuberculum is there. Dr. Nikhil, welcome. So this is generally talking about today's YouTube, and it was nice talking to you, and I hope you understood some of the questions. There was few cases in my so something about chlorum, spasm, glottism, comparative. Next time I'll definitely speak about that. Okay. Thank you so much. Thank you for joining. Until we meet next time. Bye. Next Saturday we meet.